regulators who are not financially tied to the companies that make our vaccines. So the problem with, there's a couple of problems with vaccines. When I had 3 vaccines as a kid. Today's kids get 72. And the reason they get so many is because they're so profitable. And they were made profitable in 1986 when Congress passed a law that said you can't sue a vaccine company. So no matter how toxic the ingredient, no matter how negligent the company, no matter how grievous your injury, you can't sue them, which means that company has no incentive to make them safer. And remember, the 4 companies that make all 72 of the vaccines that are now mandated for our kids are all serial felons.
Well, how did you pick this issue, though? That's my question, of all the other issues out there.
The reason I picked the issue, it kind of picked me, is that first of all, I was suing a bunch of coal-burning power plants and cement kilns in 2004 for discharging mercury, poisoning all the fish in America. And people started coming up to me at that time, mainly women with children who had intellectual disabilities, who were vaccine injured. And they'd come up to me and say, if you're really concerned about mercury exposures to children, you need to look at vaccines. And I didn't want to do it. My family's been involved in the issues of intellectual disabilities for generations. It's something I grew up with, I care deeply about, but I wanted to spend my time protecting water. One of these women came to me on Cape Cod at the end of 2004. She had a big pile of scientific studies, and she put them on my front stoop. And she was a psychologist from Minnesota. Her name was Dr. Sour Bridges. Her son had been a perfectly healthy boy, got autism from a vaccine. The vaccine court had acknowledged that that was true and given him a $20 million settlement. And she put this pile on my front step, and she said, I'm not leaving here till you read those. And I'm very accustomed to reading science. It's part of my job. I've brought hundreds of lawsuits. They all involve scientific controversy. I started reading that science, and I was immediately struck by the huge delta between what the actual science was saying and what the public health agencies were claiming.
But there is, Robert, a huge body of science that doesn't support your position.
Show it to me.
Okay. Well,
show it to me.
I can, but I'm not going to do that right here.
Show me one study.
I'll show you a lot of studies, but right now, listen, I just want to know.
Vaccinated children are healthier than unvaccinated children. Then I will put that study on my website, and I will quit my job.
Okay, we will send it to you, probably. And I have no dog in this hunt. I'm just telling you that there's a big body of science, and several family members of yours called you out on this. So what would you say to them? Not to me.
Well,
what would you say to them?
I've already said to them what I'm going to say to them, which I've written and is published on our website. What I say is, people say there's this huge body of science. What the science consists of is a tiny handful of epidemiological studies that were written by industry and by the CDC, which is part of the industry. And none of those studies all of them are fatally flawed, and I can go through each one with you. And none of those studies do what you would want a study that you wanted to exculpate vaccines to actually do, which is to compare a vaccinated population to an unvaccinated population and then look at health outcomes. The Institute of Medicine, which is the National Academy of Science, which is the ultimate arbiter of vaccine safety science, has repeatedly said to CDC, you are claiming that you have studied this issue, particularly the issue between autism and vaccines. You have not. Oh, it's not Robert Kennedy. It's the Institute of Medicine, which is the highest authority, scientific authority in our government, has repeatedly said to CDC, you have not done the studies necessary to make these claims that you are making.
In 2017, you met with President Trump and you said he was going to appoint you head of a commission about vaccines. That didn't happen. Why is that?
My assumption is, and my assumption is based on empirical observation, because I can't look into President Trump's head, that the industry at that point got to him. And, Pfizer immediately after that meeting with me, Pfizer made $1 million contribution to President Trump's inauguration. He then took people who were vaccine lobbyists, appointed them to the highest positions at CDC and HHS, and we were cut off.
You have supported an organization that put a lot of ads on Facebook supporting your position, and now Facebook has banned those ads. Do you think that Facebook is censoring you?
Of course they are. Facebook, all of the big tech is censoring any information about vaccine. That's why you can come up here and say I'm anti-vaccine, because I cannot, there's no forum.
You're partly anti-vaccine.
No, I'm not. I'm against vaccine. I'm for vaccines, but I'm for safe vaccines.
What's a safe vaccine?
Listen, a safe vaccine is a vaccine that has been tested against a placebo or against a unvaccinated group, and that with that vaccine, where we can see from science that vaccine is averting more harm than it's causing, and that's all we want. And if you show me that study, Andy, I will quit my job at the CHD. I will post that study on our website, and I will leave. Right now, not one of the 72 vaccines that is now mandated for our children has ever been safety tested.
But how is that possible? Do you really believe, Robert, that of all the 72 vaccines that you say are out there, that they're all unsafe? Is that really? It doesn't seem logical.
I don't think anybody can say that they're safe because they've never been safety tested. And the reason they're not safety tested, the reason they have an exemption, every other medicine is tested against a placebo, usually for 5 years in double-blind tests, which means you give the blue pill to 10,000 people, an identical blue pill to 10,000 similarly situated people, and then you look at health outcomes. Every other medicine, every other medical device has to go through that test. The only one that is permanently exempt from that is vaccines. And the reason for that, it's an artifact of CDC's legacy as the Public Health Service, which was a quasi-military agency, which is why people at CDC have military ranks. The vaccine program was initially implemented as a national security defense against biological attacks on our country. So people who were running it wanted to be able to get a vaccine to market very quickly to deploy it to 100 million Americans without regulatory impediments. So they said, we're not going to call it medicine because then we'd have to test it. We're going to call it biologics, and we're exempted from testing. And that's why no vaccine has ever been safety tested.
You have to admit that your position is controversial, and you have this strong reputation as an environmentalist, and a lot of people criticize you about these positions. Are you concerned about your reputation?
Well, of course, I'd rather have everybody love me, but listen, I'm seeing something where we're seeing millions of children badly injured. Here's what HHS says. If you were born prior to 1989, which is the year the vaccine schedule exploded, you have a 12% chance of having a chronic disease. If you were born after 1989, you have a 54% chance. Nobody's explaining, why do all our kids have diabetes, rheumatoid arthritis? Why did autism drop from 1 in 10,000 in my generation to 1 in 34 in the vaccine generation? Why did food allergies suddenly appear in 1989? They're all coming from vaccines. And by the way, it's not just me saying it. All those 400 diseases that suddenly became epidemic after 1989, every one of them is listed as a side effect by the manufacturers.
Well, some people say the measles epidemic that we've seen over the past few years is because they're not people getting vaccines. So there's that.
And answer me this. Why is it that CDC says that 39% of the people who got sick at Disneyland had vaccine-strained measles?
I don't know the answer to that.
Okay.
I don't have the body of work that you
what
say
it says
you have,
is, what it shows is that the problem is not that people are not getting vaccinated, it's that the vaccine is not effective as people say.
People may disagree with that. Why don't we switch to something less controversial?
They would have to explain that.
Well, okay, less controversial. Let's go to politics, which is usually more controversial than any other subject. But